Welcome, Dr. DeYoung. My name's Chris Pohlod. We've met briefly at a meeting and via email, and I appreciate you coming to the department to find out a little bit more about us. Everything was going well, but I have a foster kiddo who we had to make a follow-up for his psychiatric appointment on this date. So I will have to come virtually to give you the big ideas that I have that I wanted to share with you. So first off, um, I have been for a long time nursing a vision of a uh, pre-med student-run scribe service or student-involved scribe service for at least our department, but the hope was a pilot program that might then carry over to the rest of the clinical operation, but have received no to extraordinarily poor communication from HCI. So, where the vision stands today is to operate such a pre-med scribe service just within the Department of Osteopathy, of Osteopathic Manipulative Medicine. But what I think it will help us do is drive research, and I'll show you evidence of that in just a moment. I can tell you from personal experience, it helps maximize billing, especially when we're going to be talking about some of the novel clinical skills that I have and that are hopefully developing in others. It definitely helps with the quality of our charting and extraordinarily helpful for life balance. So I see a lot of amazingly good benefits and relatively low administrative burden. When I was able to get a small group of pre-med students together a few years ago, they pretty much ran their own schedule. So what I've been driving at is that I'd love to be able to pay these individuals pre-tax through a central mechanism rather than paying them personally, which unfortunately is where I'm kind of stuck at this point. Um, just of note, the reason I got started on this path was because I was the Associate Chief Medical Information Officer at the time we installed Athena and required the extra time to be able to do my function well. So that's the idea of the OMM Pre-Med Student Scribe Service. And just real quick, I'm going to advance the slide so you can see when I did a retrospective study, the fact that I had a scribe helped me document the locations and the frequencies of symptoms uh, or of somatic dysfunctions and how they related to the symptoms of infants. So I was able to generate graphs like this for infants where they have a relatively high number of somatic dysfunctions, and then that gets lower and lower per visit, and then we also see their symptoms changing. And we put this on a heat map to show when people come in initially with symptoms, what they look like. And then for infants, especially because they are unique in terms of um, obviously their size, but we can treat all of them and follow their symptoms quite closely. We can see that that heat map shrinks over time. And this was only made possible by um, having such very detailed documentation that's made available by the scribes. So I'd love to expand this concept to additional ideas and such. We'll get into my research ideas in just a few minutes. So for dry needling, the next couple ideas are these special skills that I've developed, and definitely we can develop more in the department. But I have been doing dry needling for approximately 2 to 3 years with about 27 hours of training behind me I'm one class away from a certification from the outfit that does the dry needle training. But I had a 17-year-old high school athlete who was running cross country, who was in pain for about a year, multiple courses of physical therapy, sports med, and she was still unable to run due to her pain. And the dry needling had her pain free within 2 visits, and then she's had a smattering of other pain layers, as I call them, surface, but she's currently pain free and doing well, approximately 1 year after I began to see her. In a 20 month, there was a 24-month-old who has profound CP, and we talked over risks and benefits. And mom granted me permission to do dry needling on several of his concerns, including his scars from surgery. And mom is noting that the dry needling seems to be better than Botox. It's quicker, less risky from a medical perspective, not injecting a neurotoxin, and his range of motion and comfort levels have increased for the muscle units that are healthy. Next, I have an elite level gymnast who had untreatable Sever's disease of the ankle, and with a combination of dry needling, OMT, and fascial distortion to her calves, she's pain free with approximately 24 hours a week of training. There have been a couple other painful spots that have shown up, but this was her initial complaint, and that was taken care of with the dry needling. And then there's a 10-year-old patient who has genetic syndrome and lived through synostosis and came to me with very frequent tension headaches. And we applied dry needling principles to the scars left over um, from her surgery, and that has resolved her head pain currently. So these are just a couple of the cases, but the uses of combining dry needling and OMT are almost endless, and it provides a very, very high level of service to the pain community. So I think just whatever we can do to magnify its impact and make sure that we are billing with the utmost levels. Uh, at this time, I simply add 10 minutes to the visit, which allows me most cases to get to a level 4. But there are dry needling billing codes and HCI's ability to help us pre-vision out what the dry needling codes would look like is minimal. Another idea that came from my work with Mark Sloan, who is a pediatrician working in child trauma. Um, they have been using what's called the Alpha Stim device to help with their children's recovery, and that it targets in a microcurrent. So this is an electrical current that is a specific patented frequency. It stimulates the midbrain and brainstem and helps significantly with depression, anxiety, insomnia, and chronic pain. I've currently had a request to both buy demonstration devices for our office and to be able to offer this service. It's hitting approximately 8 or 9 months of no response from HCI. So um, it's been around for 20 years, used in the VA. The quick story that the medical director told me, he's a PharmD, but when he was taking initial psych uh, intakes for vets with complicated PTSD who were acutely suicidal and were going to be hospitalized and put on multiple medications. He clipped it to their ears, and while he was taking the initial history, they felt good enough to return home and be managed outpatient. And there is much research behind this device. As I said, it's been around for approximately 20 years. So I find that it will be benefit to multiple patients that I have. I've prescribed it in a few and gotten fair to good results with it. And that does include a 10-year-old with a very complicated neuropsychiatric history who was suicidal, and they used it and then returned the device after it was successful because it is fairly expensive. So back to the overview, we talked about the scribe service, the clinical skills of dry needling and alpha stim. There is an additional application of microcurrent called frequency specific microcurrent that I would like to get into. We do have a local practitioner that I've been referring to, but it's approximately $3,000 of training. And as I'll tell you in a moment, I have higher priority for a different type of training coming up. But this is another potential option that we could offer. And it was initially discovered by a DO back in the 20s and 30s, I believe. So for me personally, moving on to research interests, I just published a Singultus case, a little different than the one that Jamie published. It was a friend of a medical student who had been dealing with severe um, hiccups for several years, and we were able to almost completely eliminate all feelings from her. I have a very deep interest in qualitative work. I have a project that I worked on with Dr. Stenlin that needs um, uh, final revisions for manuscripts, but I have not had the time due to clinical work balance and taking on a foster child at home. I would very much like to get into functional autonomic um, reviews to kind of take an osteopathic approach to the full autonomic nervous system, how it relates to pain, and develop the concept of autonomic load. And you saw that in the slides where infants come in with a high degree of somatic dysfunction. I think that leads to a concept of autonomic load on the system, and that as we unburden the system, that's when symptoms improve. And I think there's applications that are touched upon with dry needling as well. So the autonomic nervous system, I think, from an osteopathic perspective, um, we need to take a very deep dive into, and it'll help drive our profession forward. The other project near and dear to my heart is a climate assessment for coaches and athletes, looking specifically at bullying and toxic environments, and to create an intervention with Texas Christian University's Karen Purvis Institute um, for trust-based relational intervention, and I will get into that now. Going over to the possible idea that Jamie and I have talked about, which is an osteopathic child trauma assessment center. As you may be aware, in Kalamazoo, the CTAC had to close down due to regulatory issues with Jim Henry. But I've been mentoring under Mark Sloan for child trauma and resilience work. And there is an opportunity in Lansing with children and families, family charities, to open a child trauma assessment center. Um, I have a deep passion, started with kids from divorce, which is an ACE, and has led me into uh, ACE science and resilience. I even formed a small nonprofit, and that was because my leadership skill set at MSU is under recognized. So I took my leadership capabilities and formed my own small nonprofit. I have spoken with child and family charities, but need to do more uh, in that. Um, there is Texas Christian University has what's called trust-based relational intervention, which is approximately the state of, well, it is the state of the art um, when it comes to um, rehabilitating kids who have been through trauma. And I intend to take their practitioner training in December if I meet their criteria. And I can very much see this as a partnership between multiple factions of MSU, also psychiatry, social work, and then apply both the concepts of dry needling and OMT to this population, which I have already begun with some patient referrals. And the last thing I'd like to talk about is the OST 595 Modern Applications of Osteopathic Science elective. So it's a 9-week elective where I look at all things osteopathic that do not include osteopathic manipulation. And I do believe it had a very warm reception from many of the students, especially the ones in the Lifestyle Medicine Club. And so we make sure that it is rooted in science. We even give a lecture on how to read medical literature, but we look at diet, exercise, the gut microbiome. We had an intermittent fasting project students where the students looked into the science behind intermittent fasting and how it impacts multiple diseases. We looked at the science of breathing, basics of ACEs. I brought in an EMDR, an art therapist, for them to experience what that's like. And then the final episode was on the science behind things like past life experiences, um, post traumatic growth, and other types of spiritual experiences. And that was quite fascinating, both for me to learn new things and to teach the students. So anyway, those are my five big ideas. I hope this gives you a good sense of what I would love to see at COM. And I would also love an opportunity to just talk further about some of these subjects with you. So anyway, thanks for your time and attention. I certainly appreciate all that you're bringing to COM and look forward to your continued leadership here. So thank you and enjoy the experience here at the department.